I'd like to welcome our colleagues from the Telehealth Resource Centers, Danielle Lauder and Kathy Wibberly, to review recent updates, trends, and practices in the field of telehealth and help all of us consider opportunities for actionable telehealth-enabled solutions for enhancing value and benefit, particularly for minority and underserved populations. So Danielle Lauder is there we go. Danielle Lauder is the director of the Northeast Telehealth Resource Center, where she leads efforts focused on implementation and growth of telehealth programs through the NETRC region, as well as collaborating with the National Consortium of Telehealth Resource Centers on nationwide efforts to advance the reach and impact of telehealth. She also serves as a co-director of Medical Care Development's Domestic Public Health Division. Kathy Wibberly is the director of the Mid-Atlantic Telehealth Resource Center, or MATRIC. It's a federally funded organization to assist with the telehealth program development and sustainability in order to increase access to quality care for rural and other underserved populations. Kathy is also the director of research for the Karen Rubin Center for Telehealth, assistant professor of public health sciences at the University of Virginia School of Medicine, a faculty member at the Health Appalachia Institute, and an adjunct faculty member in the L. Douglas Wilder School of Government and Public Affairs at Virginia Commonwealth University. So I've had the pleasure of working closely with Danielle and Kathy and their telehealth resource center teams over the past 4 years when NIMAC has really expanded their work around telehealth. It's been really great to participate in each other's conferences, and they have supported the development of our telegenetics program planning website and several telegenetics documents. Kathy and Danielle both serve on the NIMAC advisory committee, and they will be in the exhibit theater over lunch today. So we're going to welcome both of them. And while they're getting started, if people want to share and chat sort of what your favorite things about telehealth are, that'd be a nice warm up. So welcome to Kathy and Danielle.
And Danielle, I just want to chime in. We're seeing your presenter mode. So we're seeing
that was my first question to ask you, whether you were seeing the right view.
Oh, sorry. I should have let you get the question out.
No, that's
first.
okay. That's okay. Thank you for that heads up. Perfect. Does that look better?
Not yet. Oh, yes, that looks great. Okay. That's perfect.
Thank you. Yes, that's always my first question. Presenting 101. We've done a few of these over the past year. So thank you so much, Alyssa. Thank you, Fred. Thank you to the entire NIMAC team and all of you who have taken time out to join us here this morning to talk about telehealth. We're so excited and have been over the past year to see really the massive explosion in telehealth utilization. And a lot of that has been due to some pretty expansive policy changes that we're hoping might become permanent in our states and across the nation. So with that, I'm going to go ahead and dive in and remind myself to speak a little more slowly because I am a fast speaker. So as Alyssa mentioned, Kathy and I are directors of 2 of the federally funded under HRSA's Office for the Advancement of Telehealth Resource Centers. And we cover sort of a lot of the eastern side of the country collectively. Just a quick disclaimer, as Michelle already mentioned, I don't have any disclosures here today, so that's simple. And any information provided is for educational purposes only and should not be regarded as legal advice, of course. So this is a map of the telehealth resource centers. If you aren't as familiar with us, we have been around for over a decade, as mentioned, funded through HRSA's Office for the Advancement of Telehealth under the Federal Office of Rural Health Policy. And our mission really is to provide technical assistance, training, and resources to folks across the country. We cover all 50 states, DC, the Pacific Basin, Puerto Rico, and the US Virgin Islands, and really meeting folks where they're at, whether you're new to telehealth, which I'm guessing a lot of folks were before COVID-19. And then now it really became ubiquitous with healthcare overnight during the COVID-19 pandemic, and we saw some amazing things happening. We also have 2 national telehealth resource centers. One is the Center for Connected Health Policy, which I would encourage you to check out their website if you have not had a chance to do that, but they really help us track all things telehealth policy, which we know has been a bit of a moving target over this past year, and has been one of the larger barriers to widespread adoption of telehealth over the years. And they are a wonderful resource for helping us and both in our region and across the nation with Medicare policy. And then there's the Telehealth Technology Assessment Center, which is actually based out of Anchorage, Alaska, and they assist with all things telehealth technology, digital health, toolkits for specific use cases and hardware, software, et cetera, video conferencing software. The TTAC team, as we call them, is a wonderful help with resources for choosing technology that's going to work for your particular use case and for providers and patients. So just very quickly, again, we really try to meet folks where they're at with technical assistance, training, developing customized resources such as toolkits. One of the things that we've seen over this past year, which was wonderful, was a lot more folks from colleges and universities, for example, across all health professions, really wanting to integrate telehealth training into their core curriculum. So development of a lot of those types of tools. We've been doing that for years, but there's been just a lot more interest, and I think we're going to continue to see that as time goes on, and really folks looking to leverage the technology to best meet the needs of folks that they're serving. And then business strategy, really thinking, so what's the balance and what's the business model, and how can we bring in revenue from this service that is important to continue to provide increased access to services, in particular for a specialty like telegenetics. So just wanted to talk a little bit about, and I love this graphic, many thanks to my colleague, Kathy Wibberly, who is with me here today, just talking through, who or what led the digital transformation of your company, your organization. One of the silver linings of COVID-19, I guess you can say, there weren't very many, but there was an absolute explosion in telehealth under COVID-19 and we were just amazed at how quickly and effectively stakeholders, providers, health systems, federally qualified health centers stood up telehealth programs when they saw the needs of their patients. And so it really has been quite amazing, and very proud of the work that folks did across the country to do that. And really, so many folks are thinking strategically, how do we continue to provide telehealth for our patients who really have benefited from this? And how do we start to address some of the inequities that have also arisen because folks didn't have the digital divide, folks didn't have access to Wi-Fi at home or connectivity, internet connectivity, or enough connectivity. And how about folks who didn't have devices or weren't familiar with the technology? And that's really, a strong focus, I know, of all of us, and you as individual providers, I'm sure, have run into this. And there certainly have been a lot of resources that have been dedicated to this in states and federally, and I'll talk just a bit about that in a second. But really proud of the efforts that folks have made, and whether it was audio only, because we know that policy has allowed for that in states and for Medicare policy, or whether it was a more traditional audio visual video conferencing appointments, and building in, assist, basically changing up your workflows to fit into a technologically delivered visit, consult, et cetera. Just really amazing what folks have done over these past few months. So as you can imagine, the telehealth resource centers have, as that explosion of telehealth occurred, the need for technical assistance and training also exploded at the same time. So we have been quite busy over these past few months. Collectively across the TRCs, we responded to over 10,000 TA requests, which is about a 350% increase over 2019. Ours was more, and I think Kathy experienced the same thing in her region, was more like 1,000% increase in March and April. So that just shows you how quickly people responded, providers, health systems responded, and wanted to get telehealth programs stood up so that they could help their patients. access care very quickly. We reached over 200,000 participants through events like this today with outreach. We call outreach through webinars and trainings and things like that, with almost 3,000 outreach events, which was certainly a large increase as compared to our 2019 numbers as well. So key policy changes, we were asked to just kind of talk quickly about this here today. And I know that many of you have leveraged these key policy changes. But for Medicare, certainly the geographic limit and site limitations, for example, the patient home could not be, it was not an acceptable or an eligible patient site. Those were waived during and still are during the public health emergency, which we're now expecting to go through the end of this calendar year. Eligible provider list was greatly expanded. However, disappointed that genetic counselors were not part of that, and we'll continue to fight. And I know many of you have been strong advocates for that. And then visit limits, certain limitations on visits were waived. Many additional services, 80 additional codes were added to eligible services over a chunk of time. Supervision was allowed via video during, it is allowed via video during the public health emergency. There are cross-state licensure requirements that were in place before COVID have been relaxed in every state, and Medicare basically.
You're talking about how to get blood drawn on patients here in our unit. And so he was like, well, that's a big problem. And we were like, yeah. And then
if we could have everybody mute.
extra nurses in this thing. Right. And we were like that.
Danielle, you will need to unmute yourself.
Thank you.
Yep.
And then tele-enabled communications, more codes were eligible for phone, and additional providers were allowed for that particular use case, which has been wonderful. And then state Medicaid, these are most commonly, every state opened up their policies for certain, but there was some flexibilities, of course, from state to state. But phone audio only was allowed in most states. The location, the home was allowed. And in many states, we have been seeing a trend pre-COVID that the home was allowed as an eligible originating site anyhow. And we're definitely hoping that Medicare follows that permanent expansion moving forward. Consent requirements were relaxed in most states. Eligible like a verbal consent was acceptable versus a paper documented consent. Eligible services, many additional types were allowed under the public health emergency or state emergency orders. Eligible providers were expanded, and licensing, same thing with requirements being waived. So we're keeping close tabs on those state policies or state emergency orders as some of them are terminated. We're starting to see a little bit of that, but most states are really following the national or the federal expansion or the public health emergency and expanding those at the same time. So looking at permanent policy change, we have already seen several states in our region that have permanently expanded some of the rules, laws, however they do it in your particular state, beyond COVID-19, which is wonderful. A lot of this is including audio only codes, adding additional services and providers, et cetera. So that's great. The state of New York, for example, and we are also seeing a lot of bills that are currently being looked at in session to permanently expand. The state of New York, under the governor's Reimagine New York Commission, had a wide sweeping policy that they are recommending several things, including effective training for telehealth for providers across all health professions. And we actually helped develop an open access platform with New York DOH and several academic medical centers in the state and other FQHCs, et cetera. Many partners are participating in that effort. And then I just wanted to call out our colleagues at the Center for Connected Health Policy have a brand new website. You can actually go in and track state by state. They have all the Medicare, not only the current policies, but what's going on with respect to bills at both the federal and the state level. So I'd encourage you to take a look at that, advocate if you're able to for those permanent policy changes, which will impact all of how we access and utilize that technology moving forward. I just called out a few bills here that were, I felt were particularly relevant to telegenetics, but expanding Telehealth Access Act. And what I did want to point out after I actually got these slides ready, the Connect for Health Act was reintroduced, which is really exciting. And I didn't get a chance to pull it into this slide deck, but would encourage you to check that out. It really looks at getting rid of that geographic limitation. It looks at allowing FQHCs and RHCs to continue to act as distant sites beyond the pandemic. It allows the secretary to change things in the telehealth law beyond the public health emergency. That's been one of the big sticky wickets, if you will, that anything that occurred changing telehealth law had to go through Congress. And we know that that's not always a quick process. And so that allowance would be very effective, I think, in allowing changes to occur. For example, adding genetic counselors to the list of eligible providers moving forward. So I pulled just a few relevant headlines for folks who may be interested. These are all live links. When you get the slide deck, you can check out, and these are changing daily as far as what's sort of in the news with respect to telehealth. You know, we were talking about the digital divide and how it can actually exacerbate health equity issues, but we're also seeing people being really creative in utilizing telehealth, utilizing technology, providing places for folks to access technology, for example, in community centers, libraries, schools that may not otherwise be being used during the pandemic, so that folks can come in and have a safe, secure telehealth visit. And using it to address social determinants of health, for example, identifying those patients who may have issues with transportation, who may have issues with financially with getting to appointments and things like that. And so doing screenings, whether it's any different number of depression screenings, substance use disorder screenings, SBIRT screenings via telehealth, and actually finding that those screenings are higher quality than maybe when you go into the office and it's rushed and the provider comes in the middle and the screening hasn't been finished yet because everybody's double booked. So we're finding a lot of those kind of innovative use cases, and folks are submitting for reimbursement because these are eligible telehealth services. So what we've been helping with a lot over these past few months is finding that balance. And telehealth isn't right for every service, but there's been a lot of innovation and people trying telehealth for certain use cases, and they found it to be very effective once they've changed up their workflow a little bit to make it fit. And so that's really been a wonderful outcome from folks who may never have thought that they wanted to use or try telehealth, or been a little bit nervous about it, have had the freedom under these policy expansions to try telehealth. And that it's, in a lot of cases, you'll see this, how Americans feel about telehealth 1 year later. It really, there's not only an expectation that telehealth will continue to be an option, but the satisfaction rates among patients is very, very high. But knowing your patients, knowing your data, knowing, you know, their limitations, whether it's connectivity or understanding how to use the devices, and if they need help, training, et cetera, there are resources out there that can help with that. And I'll show you just a couple of those in a second. But to point out that, you know, both federally and many states are now releasing their plans for the dollars that they're going to be receiving. Every state is receiving a sizable contributions through this latest Rescue Act. And a lot of states are starting to release their plans on how they're going to spend those dollars to help increase access to care, workforce development. Expansion of broadband is a huge focus, both at the federal and at the state level. So I'd encourage you to get involved in those efforts, or just stay in the loop if so that you can help leverage or take advantage of those opportunities in your state as things move forward, if you're interested in leveraging some of those to expand or implement telehealth. So what lies ahead? Will business as usual return? Should it? I don't think so. As Seema Verma said several months ago, the genie is out of the bottle when it comes to telehealth. We certainly have seen, as a nation, we weren't as prepared as we could be to leverage technology, but boy, people really responded quickly and effectively and pretty amazingly. But what we are seeing is, folks needing to and catch up with patients who have delayed care. And I know we'll continue to see studies released on how that delayed care has impacted us as a country, whether, waiting on preventive services, waiting on genetic services, and how will that impact us long-term from chronic disease, et cetera. How do we plan for quality telehealth implementation and expansion now that we've had a breather and we're hearing from a lot of folks like, yeah, we're not interested in 100% telehealth utilization, but what's that healthy balance? We know we have some patients who prefer telehealth and it's a good use case for, X. And how do we do that? And how do we get reimbursed for it and create a well-oiled machine when it comes to utilizing that telehealth? Will patients expect telehealth going forward? Et cetera. And they do. And so just we've got plenty of work to do as telehealth resource centers. And we just wanting to remind folks that we are here and that's our mission, is to help folks. So please, if you haven't connected with your telehealth resource center, please do. And we can help you get into the weeds with respect to policy, workflows, legal and regulatory in your particular state, et cetera. And just a note about HIPAA and high tech. It's really, we're feeling it's not if, but when those requirements come back. So we've been trying to help folks if you're not currently using a HIPAA compliant solution, to identify which one might be the best and most effective for you. And then just these are I call them my flyby states, but I just want to let you know that they're here. Select resources for telegenetics. Of course, we pulled out the new NIMAC telemedicine and genetics webpage, and we've got some great resources in there and a few recent articles. But we do have a telehealth resource library on our NETRIC page, our Northeast Telehealth Resource Center page, and it's searchable by topic area, author, year, you name it. So would encourage you to go in there if you haven't already. We have select resources for COVID-19, patient and client resources, including how to access devices and connectivity through a few programs, including the FCC's Lifeline program and a new one that will be released May 12, the emergency broadband benefit for those who have been significantly impacted by COVID-19. These are more focused on like videos on how to prepare for what to expect from a telehealth visit. And then the National Digital Equity Center is specifically for folks. It's located in Maine, but it can serve anybody across the country. Specifically for older adults and what they may need to access and use technology, and then policy and reimbursement resources. So I'm going to go ahead and turn it over to my colleague, Dr. Kathy Wibberly, and we'll stop sharing here.
All right, well, great. Let me go ahead and share my screen. All right, well, good morning, y'all. I get the fun part of looking at the future of telehealth and what are some of the trends. And so before I start, I have no actual or potential conflicts of interest in relationship to this presentation. And before we get going, I'd love for you all to kind of tell me what you think. What words come to mind when you talk about or think about the future of telehealth? And so I am going to put in the chat box the link to a Menti poll. So it's menti.com and use the code 11109881. And I'm going to stop sharing this screen so I can actually share the results. So go ahead and take a minute to do that.
And Kathy, you may need to hit S to hide the image to allow the results to come
Okay.
through. And we have some responses coming in chat as well.
Yep,
Oh yeah,
there
there
we
they are.
All right, so integrated, necessary, access is a big one. Yeah, innovation, uncertain, that's definitely a big piece. Love it. So I think the big trend I'm seeing here is words related to both innovation and access. And so a lot of feeling words, everything from kind of hopeful to necessary to maybe a necessary evil to excited. And I think those are all great things as we think about the future of telehealth, because there is much to be considered and much that we can experience and explore. So I'll let those words keep coming in for just a second, and then I'll flip back to my presentation. All right, awesome. Let me go back to PowerPoint. So what I'm going to do is really do a quick whirlwind tour of some of the big trends in terms of telehealth. And this surprisingly is a set of trends from 2019. So that was 2 years ago. And as you all know, much has changed in 2 years. But as we think about it, there's everything from, you know, virtual dissection and gamification and food sensors and artificial intelligence and all of these things. And if you ever want to really think about the future trends, there's a great website called medicalfuturist.com. And he basically collects like all of these trends that are coming up, creates a blog about them, puts links to the technology, has little short like podcasts and videos. And it's a great way to keep up on what is happening in telehealth. So for these next 10 minutes, I am really truly going to do a whirlwind tour of kind of the upcoming trends. And I would love for you all to put in the chat box if you think of any additional applications of any of these trends for genetics / telegenetics. Share your thoughts in the chat box, because I think this is a time for you all to imagine. And I think one thing with these trends is that it's not like Jetsons like trends. These are trends in terms of technologies that already exist but are not either currently in widespread application or currently being used in most clinical practices because they're under like research studies or under grant funded studies, and so under pilot projects. But most of these are, or all of these are currently in existence. So the first trend I'm going to take a look at is gamification in healthcare. What in the world is that? So we all know that motivation is a key to behavior change. And we all know that most of us are not very motivated to change our behaviors, at least not without some external push. And so similarly to our patients, we oftentimes want them to change their behaviors, whether it's nutrition or taking medications at a regular time or managing their weight or chronic conditions. And so what gamification in healthcare does is it builds in the techniques that people use for games. So things like Pokemon Go, you all have seen that trend, or Fitbit or the Wii, building in those rewards and those kind of challenges and sense of community to create a motivation for behavior change. And so one thing that you see on the screen is something called Digit. It's a blood glucose meter from Bayer, and it plugs into a Nintendo DS or DS Lite gaming system to reward kids for actually testing their blood glucose. If you think about how gamification could actually not only impact patient behavior, but also professional research behavior. So on the right-hand side, you'll see that there's a citizen science game like Philo and Colony B and Borderland Science, where they're actually they're advancing genetic research by playing a game that looks at sequencing and spotting errors in sequencing and correcting errors in sequencing. And people have been playing this and actually have been advancing the science in genetics just by playing games. And this is things that like professionals are doing on their free time because it's fun. And so, think about games and how that might impact telegenetics and genetics as a field. Another big trend that we're seeing is virtual reality. And many of you have probably seen this in the game realm if your kids are playing games, but we're also seeing a lot of this in healthcare. A really cool example of this is Kind VR. And Kind VR has been tested in many, many situations now. But what VR does is it immerses a person into um, a computer generated environment. And so you actually see cognitive and physiological reactions to being immersed in this. So imagine, if you are standing on top of a cliff and you are afraid of heights, your heart will start to beat faster and your blood pressure will go up, and you can monitor all those things through a virtual experience. Well, they're showing that you can use this virtual experience to actually help people um, manage their pain, to relax, to do stress management, to actually control high blood pressure. But the military is using it for PTSD treatment to deal with phobias and fears. But you're also seeing it for provider and patient education and training. With the pandemic, we had a VR example or demo of how you actually use PPE correctly. And so the person puts on the VR glasses and actually virtually puts on PPE, and it alerts you to, you're touching your face when you're not supposed to be, or you're not you're washing your hands correctly. And so a lot of that training can happen through the virtual reality. But a very cool example is Kind VR has been used at Children's Hospital, and they actually have a video around it. And it's using virtual reality in a research study to help patients with sickle cell disease mitigate their pain. So think about how VR could potentially be used in other genetics settings and in care. So this is an example that I'm going to actually show by video of how virtual reality can be merged into telehealth visits. And this is what it looks like for the future.
At Silverchain, our vision is to deliver the world's best health and aged care in people's homes so they can live their whole lives as they choose. We know that Australia's demand for healthcare is increasing, partly because of an ageing population, but also because of the increased number of things we can do in hospitals. And our research shows that about 30% of people in Australian public hospitals today don't need to be there. And we know we can deliver them really high quality care at home. Now, this will not only increase the safety, increase the convenience, and be what people prefer, but it will relieve the pressure on our public hospital system for people who really do need that level of care. Our new technologies allow nurses who are on a day-to-day basis responding to clients in their home to be able to have really good access to the data, be able to have their hands free while they're reading data, but also importantly consult with a doctor and have the doctor see what the nurse is seeing and the data at the same time as giving the nurse advice about how to treat the patients. This significantly increases the capacity of the nurse to practice at the top of her profession, and it gives the doctors an incredibly efficient way of being in many places at once. Enhanced Medical Mixed Reality, or EMO as we call it, creates a hologram of a doctor. So the experience is a doctor's really personally in your home, talking to you, in dialogue with you, looking at you and consulting with you about your healthcare. So the experience is a doctor has come to your home and visited you. We think this is going to meet the demand for increasing healthcare for our community in a way that's not only less expensive, but is much closer to what people want and takes the pressure off our hospitals for the future. It's part of our vision for a new generation of healthcare for Australia, and it's coming soon.
So, this is the kind of thing that's in progress, and it is not Jetsons-like in that it's already being piloted in Australia. And they're mixing the virtual reality with the hologram images. And interestingly enough, as the doctor can actually see the patient in 3D in these hologram images. And so they can get the patient to move and to walk around and see and visualize what's going on in the room for that patient. And so very interesting applications. Another piece, we all have heard about remote monitoring, but the next trend is having sensors both inside and outside the body. And so one thing that is being currently tested are what's called smart pills. And so they're miniature electronic devices that basically you swallow, and they can track everything from doing diagnostic imaging internally to vital sign monitoring internally to targeted drug delivery. So you can really wait for that drug to be at the right time, at the right release point, in order to deliver what's needed. And that could be everything from pain management to decreasing blood glucose at the right time. So really interesting applications that are currently in development. Artificial intelligence, I think you all have been hearing about this for the last couple of years, but artificial intelligence combined with chatbots is an upcoming trend. We've already seen a lot of that with COVID-19. A lot of people are using that as kind of a triage tool, and many of you are probably using applications that allow you to screen your symptoms for COVID. And if you answer in one way, it directs you to a different path. And if it answers in a different way, it brings you to a different path. Some of these chatbots are actually connected to in-person care. So if you answer in certain ways and it's a high alert, and it directs you to a telehealth encounter automatically, because you definitely need to be seen quickly. But AI and chatbots can be used for triaging patients, counseling patients, providing education to patients, guiding them toward appropriate care. So we've seen a lot of it in screening, but we're also seeing a lot of it in emotional and physical self-care, emergency first aid, and medication and care management. And so a lot of patients don't take medication as prescribed, and they risk their health because of it. And so there is a chatbot called Florence that reminds users to take their medication. And it actually asks them questions about, why aren't you taking your medication? And it helps to direct them to answer some of those questions. If they say like, well, I'm having side effects. Okay, well, what side effects are you having? Let's talk about that, and really kind of guides them to some solutions to the problems that they have, instead of, waiting the 3 months or the 6 months for their next checkup before disclosing that I haven't been taking my meds because it doesn't make me feel good. So those are some things. But the Cleveland Clinic is actually using telegenetics chatbots to address genetic cancer risk. And so it's used as a triaging tool, and it actually has identified a percentage of patients for referring to an in-person genetic counselor for genetic testing as a result of the chatbot use. So very cool application. Here is an example of what's going on with merging artificial intelligence with personalized or precision medicine.
Since the beginning of healthcare, doctors have suited medication to the disease. But what about suiting medication to the patient? Today, we know for a fact that patients suffering from the same disease can respond to the same treatment in different ways. For many, this one-size-fits-all approach is anything but helpful. Not only do a tremendous amount of patients not receive the appropriate treatment, many of them suffer serious side effects and simply give up. Does that really sound like healthcare? Think about this. Millions of patients across the globe, from different cultures, with different lifestyles, all with different genetic and clinical characteristics. There's an endless amount of information available. This is big data, and no one has been doing anything with it. That's where we come in. Meet Telehealth, tailoring the right treatment for each individual. A groundbreaking genetic, clinical, and demographic-based tool designed using a unique and sophisticated platform of predictive machine learning algorithms. A unique tool that has been validated against the world's largest data sets. Here's how it works. A DNA sample is taken from the patient in a simple and painless process. A number of background questions are uploaded to the cloud, and the Telehealth tool goes to work. The data goes through cross-analysis using prediction algorithms based on countless comparisons between genetic and clinical data of patients around the world. Within a short amount of time, a recommendation is received on the most suitable treatment for the individual. This is how healthcare should be. Telehealth, tailoring the right treatment for each individual.
And while, my presentation is not endorsing any particular vendor, what I love to do is really show you what is in development, and think about, if one vendor or one company has developed this, there are many, many more in progress. And so think about these applications for genetics and for treatment of genetic conditions. And the last trend is merging artificial intelligence with robotics, and this is very cool.
Would you like to hear a song?
Yeah, absolutely.
I hope you enjoy my version of These Boots Are Made for Walking.
Stevie is what's called a socially assistive robot. And by this we mean it's much like any other robot. It has sensors and motors that enable it to move around in the environment, but it also has more human-like features that allow it to interact socially with people.
069, 069. I heard the summer was good this year.
Your dose has been dispensed.
Robotics has a potential to play a huge role in elder care facilities and hospitals, to be able to enable people to do more with less.
Technology then becomes a force multiplier, if you will, to allow humans and caregivers to provide better care. If we can use robots and different technological solutions to automate mundane processes, it frees people up to be more human in the caring process.
So I think, you get a little sense of what's coming up in the future and not too distant future as well. And I think Danielle has already touched on some of these things, that because we have this advance in technology that's rapidly growing, we are at a point where we do need to ensure that the growth of this telehealth technology doesn't exacerbate disparities in care. And so we've already talked a little bit about, digital technology and access to that technology, digital literacy, and being able to educate people. And then this, obviously the cellular coverage and the internet access are all going to play a role in this. And so there are both challenges and very huge opportunities ahead in terms of healthcare. So just really quickly, this is our website, matrc.org. There are links to that. And so Danielle has already told you about many of the resources that are there, but we are definitely here to assist you. And this is our contact information if you want to reach out to either Danielle or I for any reason or for any of your technical assistance needs.
Great. Thank you so much, Kathy and Danielle. We are almost out of time, but I think we have about 1 minute. I'm wondering if you guys can point us to a really good resource. I know there's been a lot of webinars and announcements lately about resources for families who need support in getting connected, either technology or broadband. Is there a central place that people can go to identify those resource opportunities?
I know that on our website, we have in our COVID-19 toolkit a section that's dedicated to technologies and HIPAA and just broadband access. So if you hit on that, there is a section on that gives you like free and low cost resources. And it also points you to where you can access the different links to those resources.
Mm-hmm.
Perfect.
And some of them are state specific, but they're wonderful resources. So if you're looking for specific states, connect with us and we can connect you, for example, with the folks, the National Digital Equity Center. There's Telehealth for Seniors. Some of them are also specific to populations. For example, although Telehealth for Seniors started with that group, but they've widely expanded and they're providing education, training devices for anybody at this point in time. I also put in the link, there seemed to be quite a lot of interest around the community center concept of providing access. So if you live in rural, you could, go to your local school or library. So the USDA Distance Learning and Telemedicine Grant Program is now open. So I put that link to, it is specific to rural. So you have to be serving rural populations, but there's going to be a lot more of, through state funding, through the FCC funding, that will be available to help support those kind of build outs of places where people can access, and then the training to go alongside it, to use the devices, to use video conferencing, etc.
Perfect. Well, thank you both so much for being here. It's really been incredible to be on this ride with you and see the evolution of the types and scopes of telehealth solutions that we've been exploring over the past 5 years together. And I really encourage all of you to identify and utilize the telehealth resource centers and to seek out the NIMAC telegenetics resources as well. Kathy and Danielle will be in the exhibit theater today during the lunch break if you have more questions for them. And right now I'm going to pass it off to Dr. Berdertha to welcome our next speaker.